The debate, Mr. Fraser.
Thank you very much, Madam Chair. And I just want to add that it, as the members, what the member was bringing up, what France was bringing up is all very, very relevant. Very relevant. And you have to understand from this side, okay, we have to give expression to those people who are expressing concern. And there's been a number of them. And I know on that side that you have a job to do as well, too. But we have time. And this bill is moving at warp speed. Warp speed. Mike Harris took more time. He took more time than a Liberal government did when we did restructuring. And the reason you do that is you got to get it right. This is half of what we do. This is the most important thing to families, especially when somebody's sick. Nothing else matters. And if we mess this up, something happens farther down the line. And here's the problem with that. We don't see it. We don't see it from this vantage point. We can't see it. So that's why we have to get it right. So what France had to say is very, very important. Inside Schedule 1, we failed to protect community stake in healthcare. 100%. Not a criticism, fact. We've put in no mechanism for appeal. We've not extended any timeframes. It's not something I'm very proud of as a legislator. You know, who owns the Peterborough Hospice or the Peterborough Regional Health Centre? Who owns Stedman? Who owns the Grand River Hospital? Is it the Ministry of Health? No. Is it the Ministry of Health? No. Is it the super agency? No. It's the people who live in those communities. It's their care. It's their money. And we've put nothing in this bill to protect them. And that's wrong. And 10 years down the road, when we're in our communities and things start to happen, and I've seen it happen because I've seen it happen 20 years ago, where they try to close a hospital or close a really important service, and we don't have the tools to protect our communities, protect those people that we live with, protect our families, we're going to, what do we do? What's the rush? Why are we in such a hurry? My gosh, it's half of what we do. It's about $30 billion. If you were sitting on this side, you'd be saying exactly the same thing I am right now. So I'm not going to belabor it because I know we want to vote on this section. But let's not kid ourselves about Schedule 1. We did nothing to protect our communities in there. We should have done it. And I can't support Schedule 1 simply because that's not there. Thank you, Chair.
Thank you for the